Good morning. In this video, you're going to learn my two favorite strategies for helping fix chronic knee pain. Anyway, I'm Dr. Craig Dingman. This is Elevate TV. We're going to broadcast live to you every 10 a.m. with healthy tips and strategies to help you get the most out of your health. Anyway, Dr. Sean is mouthing to me in the background. So I have two suggestions for you for knee pain. These might surprise you. In fact, most people, when I suggest these things, they kind of look at me sideways at first because they're probably contradiction to what you've been told. But if you do them right, they're the greatest strategies for your knee. And particularly lately with people getting outside again, a lot of people are coming into practice and talking to me about knee pain and aggravation. They're out raking. They're doing all sorts of things they haven't done for 6 months, and they're getting knee pain. So these are my two favorite strategies. One's going to be on the bike, and the other is going to be using a door frame. Not everyone has a bike. Most people do, and I'll teach you how to bike properly to help your knee. Everyone's got a door frame inside the house. So why don't you follow me, come on over here, and we're going to go, and I'm going to demonstrate on this door probably the most important activity that I've got, especially if you've got chronic knee pain. So most of us in most of our daily routines are sitting almost all day, whether you're sitting at the kitchen table, whether you're sitting at work, sitting in the car. Humans were not made to sit in a chair, and we spend most of our time doing that. Physically, people were designed to sit, not to sit, but to stand, to walk, to run, to squat, and lay down. And one of the things that's almost forgotten is squatting. It's really important because in order to remedy your knee, you need to move your knee through a full range of motion. Now, if you're just walking, which will help your overall health and fitness, it's not going to do much for your knees because at no point in the gait cycle do you move your knee through an entire range of motion, right? It's very limited just through this range. So, easy way to squat and a safe way, even for those of you who have chronic knee pain, is to use a door for help. So, an interior door, you open it about 45 to 90 degrees, whatever you have room for. And the benefit to having the door is that you have these door handles so you can use your arm if you get caught in a deep squat. So, if you're worried about this, you're thinking, I can't get down low, I can't squat deep. I've got patients in their 70s with double knee replacements who are now doing this and loving it. It's strengthening the knee very, very safely. So open the door. You want to have your feet slightly wider than shoulder width apart, toes pointed slightly out. You want to grab the doorknob with both hands and then look up at the door towards the top. Keep your eyes there, and you just squat as far down as you can get. Now, the benefit is, if you've got bad knees or you're starting this out and you don't have the strength yet, when you get down low in the squat, you can always use your arms to pull you up if you feel your knees giving way a bit. Okay, and you want to get down as low as you possibly can. The other thing you want to pay attention to here is you want to get the lower leg bone, this bone here. You don't want it coming forward as you squat. That's going to increase the strain on your knee. You want it as close to perpendicular to the ground as possible. So you want to be in here, right like this when you're in the bottom of your squat. Okay? Every day, do sets of 6 or 8 or 10, repeat it a few times, but squatting is something we should do every single day. Most cultures in the world, well, they have to squat at least twice a day. For boys, more often for girls. Over here, it's a lost art. So anyway, the other strategy I want to show you is on a bike. Most people have a bike. If you don't, great garage sale item, especially this time of year. Now, I've got my fancy road bike set up here, and it's rigged on one of these fancy trainers that I use in the winter to ride my bike. If you don't have this, you might need a helper or two, someone to hold the bike steady while you get on it, and you can adjust the pedals. Cycling is potentially going to move your knee through a great range of motion with virtually none of your body weight or stress or strain on it. So it's really super, super helpful for anyone with chronic knee pain. But you want to get the bike set up right. So I've had patients come in who have had knee pain or knee replacement, those sorts of things, and they're talking about how biking is very, very difficult and aggravating. So if biking is painful for you, you likely haven't got the seat and the pedals hooked up right. So if you feel like you're pedaling around your ears through the whole cycle, your seat's way too low. And there's no way you should be able to sit on your seat and have both feet on the ground. If that's the case, then your seat's way too low. So I'm going to hop on the bike. It's going to look a little different because it's set for my special shoes that have clips for the pedals and whatnot, but let me show you how it's going to look, okay? So first thing you want to do, like I said, either get one of these clips to hold it or have a friend or two hold the bike steady. You're going to need a camera here or a mirror or someone watching to help you set this up. But when you're on the bike, you want the pedals adjusted so that you got a slight bend in your knee, okay? So as I come around, you can see each stroke there's a slight bend, and if you imagine the line coming straight up from the ground, this angle with my leg and that line from the ground should be about 25 degrees. Now, I know some of you type A's are going to probably want to get a protractor or a goniometer and measure it. It doesn't have to be that precise, okay? All you want is to have a slight bend. You don't want your knee totally locked out like this at the bottom, but certainly you don't want to be pedaling up here with your knee this bent at the bottom of your stroke, because that will definitely irritate your knee. Okay? I'm going to show you on the recumbent bike, because we got another option here. Not many people have these, but you can adjust this the same way, and I'll demonstrate. So this is about right for me. You can see at the end of the stroke, there's a slight, maybe 25 degree here. You definitely don't want to be, this is what I'm talking about, like when you got to kick out each time, that's way too far away. And the other option that I find most people are guilty of is like you're riding your kid bike with your knees up around your ears, okay? Way too high, that is going to hurt your knee. Anyway, there you have it. Thanks for joining me. Like I said, join us every Tuesday morning at 10 a.m. for other tips and strategies on Elevate TV. Thank you. Have a great day.